Good morning, everyone. It's time for a Henry County Health Center FYI. And in observance of February as American Heart Month, we have the opportunity to sit down with Andrea Moeller and Kimberly Novak to talk about cardiac services at the Henry County Health Center. Good morning, ladies.
Good morning.
Good morning.
Well, would you guys just start off maybe with an introduction of who you are and what your position is at the Henry County Health Center?
I'm Andrea Moeller, and I'm a nurse at Henry County Health Center. I graduated from the University of Iowa with a Bachelor of Science degree in nursing. I've worked here for 21 years and in the cardiac rehab department for 19.
And my name's Kimberly Novak. I am one of the respiratory therapists on staff here at Henry County Health Center. I have a bachelor's degree in healthcare administration and an associate's degree in respiratory care. And I've been here for coming up on 7 years now at Henry County Health Center.
Well, Andrea, why don't you start us off by talking about cardiac rehab nurses? You know, the certifications, the qualifications, all of that good stuff.
Yeah, cardiac rehab is staffed with 2 nurses, and respiratory therapy also helps out. And we all have experience in critical care, which is needed in the department. We all also have advanced cardiac life support certification. Our cardiac rehab program, we are nationally certified. It's a process that we apply for every 3 years, and this process involves monitoring patient outcomes like their exercise improvement, their eating habits, and also their mood. And along with the outcomes, we review our policies, procedures, and with doing the certification, it keeps us current with the national standards.
And Kimberly, do you want to talk about respiratory therapists and your involvement with cardiac patients?
Sure. So as respiratory therapists, we are involved with the cardiac patients from the time they come in, say, to the emergency room with chest pain, or even if their primary doctor orders an outpatient EKG, we perform those EKGs. And then from there, we might even do a stress test on the patient or place a cardiac monitor for the patient to wear. And then if the patient does then need some kind of a cardiac procedure like a cardiac catheterization or stents placed, then we'll see them in cardiac rehab when we help out the cardiac rehab staff. So we're kind of every step of the way seeing the patient.
I know, too, that you guys have visiting cardiologists who get to see patients at the Henry County Health Center specialty clinic. Do you want to speak as to why that's beneficial for area residents to have access to specialists just right here locally?
Sure. It's actually really handy. It eliminates travel time for a lot of patients, or at least decreases travel time. And that way, you know, they're able to get in a lot of times more quickly with their cardiologists. And we do have several cardiologists that come here. We have Dr. Mahegan, Dr. Allen, Annalisa Cochran, and Ed Melcher from Mercy. And then we also have Ann Ashoff from the University of Iowa that come here. And they're usually here at least twice a week. We have a cardiologist here, sometimes more.
So with that, I guess let's transition a little bit to Heart Month. Maybe we should talk a little bit about heart attacks, and can you give some information about the signs, the symptoms, and things that people should be aware of?
A lot of times with heart attacks, there is some kind of an upper body discomfort. Like a patient might have chest pain, pressure, they might have tightness, heaviness, burning, squeezing, or aching in their chest. And then a lot of times the pain might move to their arms. And women actually present a little bit differently. They will oftentimes have pain in their jaw or their back. And then a lot of times people will also have shortness of breath. They might feel like they've been working really hard. You know, they're worn out, have some fatigue. They could even have heartburn or indigestion. They might have cold sweats. There are a lot of signs and symptoms that could indicate a heart attack. So we just kind of urge everyone, if you have any of those, it's best to just go to the emergency room and get checked out. I would rather it be nothing than have it be something and, you know, someone didn't go to the emergency room.
100%, yeah. So let's say somebody does have a heart attack and then they need cardiac rehab. Andrea, do you want to talk about the cardiac rehab department and the services that are offered?
Yeah, with cardiac rehab, there are 3 phases. Phase 1 is done as an inpatient, so after a person is hospitalized with a cardiac event, such as a heart attack, stent placement, valve replacement, heart bypass, or congestive heart failure, they are seen in the hospital and exercise is performed. And phase 2 is what we have here at the Henry County Health Center, and this is after a person is discharged, and the exercise is done as an outpatient. And most times our people attend 2 to 3 times a week for as up to 12 weeks. And with exercise, they're monitored. We put a heart monitor on them and monitor their heart's response with exercise. And then we also have a maintenance program at the hospital here where people can continue with exercise. It is supervised by a nurse or respiratory therapist. We do check blood pressure and heart rate and help them if they need with the exercise equipment and setting up an exercise program.
Sounds like it's a really great, thorough program. How can patients become involved in it?
Cardiac rehab does require an order from the person's physician. Most times we receive the order directly from their physician when they're discharged from the hospital, but sometimes if a patient does want to enroll in cardiac rehab, they can just give us a call and we can call the doctor for the order.
Can you speak a little bit on cardiac rehabilitation to improve quality of life?
Yeah, we hope that cardiac rehab patients, after going through the program, that they have that confidence and reassurance to be able to get back to the normal activities, to be able to exercise safely on their own, and have just that reassurance to do their normal activities. Along with the exercise and cardiac rehab, we have education classes, and these look at the risk factors of heart disease, like eating healthy, exercise. We look at stress and how to relieve stress. We look at high blood pressure and cholesterol. So along with the exercise and the education, we hope that they can make some changes for a healthier lifestyle.
What diagnostic tests do you guys have at the Henry County Health Center, and how do these tests help evaluate heart health and diagnose heart problems?
Our radiology department performs echocardiograms, and our cardiopulmonary department does EKGs, which are electrocardiograms, as well as 4 different types of stress tests, which can be exercise or non-exercise stress tests. And then we also do cardiac monitors. And what these do, they check for blockages of blood vessels that supply blood and oxygen to the heart muscles. And then we're also checking for, with the echocardiograms, we're checking for abnormal heart wall movement. And then the stress tests and the EKGs and the cardiac monitors also check for abnormal electrical activity of the heart. So they're all kind of checking for different things, but they all do check for cardiac disorders.
And for more information on all of this stuff that we've talked about on cardiac services at the Henry County Health Center, who can be contacted and how?
You can call our cardiopulmonary department at 385-6104, or our cardiac rehab department is 385-6504.
Awesome. Well, Andrea Moeller and Kimberly Novak, it's been great talking with you about American Heart Month and the cardiac services available at the Henry County Health Center. And happy Heart Month.
All right. Thanks. Thank you.